Everybody? All right. So first off, thank you all for coming today. My name is Senator Roland Gutierrez from District 19 in San Antonio. I have been for many years a proponent of this TCUP program. Quite honestly, in the very inception of it. First off, thank you all for coming today. My name is initiated this program inter legislation in the House. I was a little skeptical. San Antonio, and through the years and through the sessions, this TCUP program has improved and continued to improve. And I think today stands on what can be a very good platform into the future as we created the TCUP expansion in this last session, which sought to go off and get some other ailments underneath its umbrella that allows more people, more of our veterans to be able to take advantage of TCUP. Now that particular piece of legislation passed. What failed was the hemp ban, which was the ban that came out of the Senate. The Lieutenant Governor was very much pushing a ban on these 8,000 C-stores, hemp stores that you see. And we've gotten a significant amount of pushback. The governor has since vetoed that bill. And here's the problem. And here's where we are today and where we need to be going forward, and hopefully where we'll be in the years to come. I have always been for a fully regulated medical marijuana program and recreational marijuana program like we have seen in Colorado, California, Washington State, and over 30 states in this nation. We must do that. But in order to do that, we have to take these appropriate steps. And what happened when we created the hemp bill and these C-stores started finding THC derivatives? And what I mean by derivatives is not the Delta 8, Delta 9, but the synthetics that are derived from therein. And those synthetics are causing great harm to young people throughout this state. We created a system, a Wild West system of obtaining cannabis products with zero age limit. So I think people at home need to be aware that there is zero age limit in obtaining this. You can go to a convenience store right now, be a 14-year-old kid, and be able to buy a vape pen. And that simply is wrong. It's not right. And all the science will tell you that that 14-year-old is not ready for the introduction of cannabis into their body. And so we need to do better. And by doing better, we need to find a bill that has some regulation. My hope is that that piece of legislation does help some of those farmers, sure, help some of those retailers, sure, but at the end of the day, we have too many people out there that are acting irresponsibly, that are selling a product to minors that simply must not stand, and we have to be able to change it. And we also have to do something about getting rid of the synthetics. Now, as to this TCUP program, the expansion of TCUP was vitally important to our veterans in this state and vitally important to people in need. We need to do better for this program. We need to continue the expansion of TCUP and continue to find a way and a pathway for a completely regulated system, a tiered regulated system like we have in alcohol, where you have package stores that are just disseminating this product possibly. We have to do something that makes sense for us. To do nothing, which is where we were when this veto began, is not a tenable situation for the youth of the state of Texas. We cannot have 13-year-old boys, 16-year-old girls, you name it, accessing cannabis with impunity. And we cannot have synthetic drugs with no kind of medical review, FDA review, you name it, on the market that have never been looked at by any kind of licensed Texas laboratory. We can do better in Texas, and the people behind me are going to tell you more about that. Next, I think we're going to hear from a TCUP patient, Christina Donnelly, after which we'll hear from Dr. Rezaie and Nico Richardson, who is the CEO of the Texas Original, and then I'll be closing up and we'll open up for any questions. So thank you very much. And with that, I think we'll hear from Christina.
Good afternoon. My name is Christina Donnelly. and I'm honored to share my personal experience with the Texas Compassionate Use Program and the profound impact medical cannabis has had on my cancer journey. On December 21st, 2021, I received the life-altering diagnosis of triple-negative breast cancer following a lumpectomy. As a mother of a 15-year-old son at the time, the thought of what that cancer could mean for our future was distressing. Immediately, I began 16 rounds of chemotherapy and 21 rounds of radiation. By my second chemotherapy treatment, my hair was falling out in clumps. I shaved my head bald, surrounded by friends and family, to alleviate the intense scalp pain. I also experienced extreme fatigue, relentless hot flashes that made sleep feel impossible, and a total loss of appetite. I dropped 7 pounds in a single month. Anxiety and insomnia became my new normal. It was during this period that a friend informed me of medical cannabis. Candidly, I held reservations about its potential efficacy. However, following a severe panic attack and losing a concerning amount of weight, I felt compelled to explore this option. The first evening I took the medication, I experienced 7 hours of uninterrupted sleep. Within 48 hours, my appetite was back. My anxiety levels also diminished significantly, giving me a more hopeful outlook on my recovery. I am here before you today having just passed 3 years in remission of the vital 5-year mark. Those of us with cancer know it is never truly over, as cancer has far-reaching and long-term impacts to our mental health. And I'm grateful that this prescription continues to aid me in maintaining a normal life. Throughout this journey, I've been careful about what I put in my body. Having a safe, regulated medicine tailored to me with the guidance of my doctor gave me real peace of mind. It has improved my symptoms without adding new ones and has made a meaningful difference in my physical health and quality of life. Thank you.
Hello, everyone. My name is Dr. Rezaie. I'm a palliative care physician at the Center for Cancer and Blood Disorders, which is a community oncology practice that covers all of DFW. Since I became a participating physician in the Compassionate Use Program in 2021, I have registered over 800 patients, many of whom were like Christina, all of whom have one commonality. They all have advanced stage cancer, suffering from symptoms related to it, as well as the adverse effects from their treatments. I have a couple of patients who stand out, just seeing the profound impact of having medicinal cannabis available. One of them was very early on in my journey with prescribing medicinal cannabis. Not only did she have metastatic breast cancer, she also had very poorly controlled Parkinson's disease. And I remember having our first visit, because she lived rurally, we did a televisit, and she was holding her phone, and it was tremoring so badly. And she was also having decreased appetite as a result of the cancer and her treatment. So we talked about the Texas Compassionate Use Program. I was able to prescribe for her. Within 4 weeks, not only had her appetite improved, she was holding her phone and it was still. And it just blew my mind. And I was like, there is something here. More recently, I saw one of my patients who's a very young, she's a 30-year-old with metastatic cervical cancer. Not only does she have the decreased appetite and nausea related to her chemotherapy treatment, she has significant pain that is, to an extent, being managed by opioids, but once I prescribed her the medicinal cannabis, she has been able to pull back and scale back on her opioid need, which is also a very tremendous feat in this day and age, especially with cancer. My patients are just a fraction of those who do and can potentially benefit from this medicine. Texas must support and strengthen the Compassionate Use Program for our patients, and that happens with expanded access to the medical program under HB 46 and stronger oversight of the hemp industry to protect the public, especially children, from unregulated and under-tested hemp products. Thank you.
And then we also have Dr. Coughlan here, please.
Hi, my name is Ryan Coughlan. I'm a rehab physician who specializes in brain injury. My experience with medical cannabis stems from my work in hospice medicine. I use it as a modality in the treatment of pain, cancer symptoms, PTSD, movement disorders, and neurodegenerative disorders like Alzheimer's dementia. I can tell you the patient success stories are truly unbelievable. I've got goosebumps just talking about it. I knew a man with Alzheimer's disease who spoke only gibberish and swatted at staff trying to help him. He started medical cannabis and became more calm and tolerant of personal care. He no longer spent all day with wet pants when he was incontinent. From time to time, he was even able to interact with his family. And most importantly, he was able to tell his family he loved them one more time before he passed. I cared for a middle-aged woman dying of heart and respiratory failure who described her symptoms as breathing underwater. She didn't tolerate the typical narcotics or sedatives or benzodiazepines we use to help most patients. They all made her too sleepy and confused. Medical cannabis allowed her to spend her remaining time with her loved ones, awake, present, and no longer suffering. As you've heard, the Texas Compassionate Use Program provides relief from life-limiting symptoms that no pharmaceutical prescription can. For my patients, it may literally be the difference between psychosis and one last I love you. I ask for this legislature's support of the Texas Compassionate Use Program so that I and other physicians and patients can continue to offer and receive dignity, relief, and peace. Thank you.
Hello, my name is Nico Richardson, and I'm the CEO of Texas Original Compassionate Cultivation and a member of the TCUP working group. Prior to joining Texas Original, I spent 10 years helping to expand access to medical cannabis across the U.S. I'm here to highlight, like everyone here, the vital role that the Texas Compassionate Use Program plays in providing safe, legal access to medical cannabis. Unless action is taken to address the unregulated hemp industry on the other side, TCUP and its patients who rely on it will remain in jeopardy. Since 2015, the Texas Compassionate Use Program has provided safe, regulated access to medical cannabis for thousands of Texans. The program began as a treatment option for patients with intractable epilepsy. After documented success from doctors and patients, the program grew to include conditions like PTSD, cancer, MS, Parkinson's, and Alzheimer's. Every day, we hear from patients whose lives have been changed for the better because of this medicine. Excuse me. The reason this program works and is trusted by physicians and immunocompromised patients is because it is highly regulated. Prescribing physicians can therefore be assured of product quality and patient safety. But let's quickly talk about these regulations that create that product quality. Our operations may only occur at a single DPS-approved location with restricted badge access and perimeter fencing to protect from potential diversion. Our facility must be purpose-built to house the company's cultivation, manufacturing, testing, and distribution. All inventory must be secured in steel cages under lock and key. Every square foot of the facility that houses plant material or finished inventory has to be under 24/7 HD video surveillance with footage stored for future review. The DPS conducts at least one scheduled inspection of our facility per month and then additional surprise inspections throughout the year. All products must be pre-approved by the DPS before we send to sale. Every batch of every product that's manufactured must go through stringent in-house testing, potency, contaminant testing, including microbial, pesticide, and heavy metal tests. All those C of A's from the test are reported directly to the DPS. Then inventory is randomly selected by the DPS to be tested again by a third-party lab to verify results. Every product sold must be registered in a DPS database in the event that there is a recall. Patients are prescribed a set number of milligrams by their doctor, and we can only fill the milligrams and products that the doctor has prescribed. The patient's THC milligrams are logged into a secure registry that is accessible to the DPS and the doctor to ensure the patients are not overserved. The strict oversight of this program is made possible by the significant licensing fees paid by TCUP operators. TCUP licensees must pay the department a licensing fee of $488,000, then a renewal fee of $318,000 every other year. We must also register every employee with the DPS, perform background checks on those employees, and pay an annual fee of $530 per year per employee. That's for us, we have about 100 employees touching the plant, so that's roughly $53,000 in addition per year. It adds up total to about $212,000 per year by each TCUP license. By comparison, hemp-derived THC products do not have to abide by any of the regulations I just listed, even though most of those hemp products sold today in Texas are far more potent than what we are allowed to sell as TCUP medicine. To obtain a license to sell THC products can be imported from other states, then sold in Texas with no prior approval from dishes. Regulators have no oversight of those manufacturers out of Texas and cannot perform inspections on these out-of-state facilities or verify that the C of A's are accurate. There are no restrictions on the use of cheap synthetically derived cannabinoids, which are down here, like Delta-8, HHC, THCP, which is reportedly 30 times more potent than Delta-9 THC. All of these cannabinoids, synthetically derived, semi-synthetically derived cannabinoids, are banned in our medical program in TCUP. Hemp retailers regularly advertise their locations as medical dispensaries. I'm sure many of you have seen the Green Cross hemp dispensaries in your areas. Those are not TCUP licenses. And market products as medical grade without obtaining a medical license or abiding by medical safety standards. It is widely reported that these products often contain unlisted ingredients, including residual solvents and unlisted cannabinoids. These are serious risks to consumers, and Texans deserve to know what is going in their bodies. The inequity of these two programs leaves the TCUP in peril. This section, we did have an expansion bill, and I thank you, Senator Gutierrez, for voting for that, voting in favor of that, which was HB 46, which was signed into law and made several improvements to the accessibility of our program. The changes in HB 46 allow for inventory storage at approved locations, for vaporization devices and pulmonary inhalation. It includes new conditions like chronic pain and 12 new licenses. All of these changes would have increased accessibility to the program and competition. HB 46 was passed by bipartisan lawmakers with the belief that intoxicating hemp products would be restricted or banned. Without these restrictions, the TCUP will continue to be eroded by an unregulated THC industry, and our medical program will potentially collapse. And no one should be surprised by that. No one should be surprised that a heavily regulated medical program cannot survive when it has to compete directly with an underregulated recreational program selling the same or more intoxicating products. The legislature has a chance to do this right in special session. We are calling on lawmakers to support the TCUP and rein in unregulated recreational THC industry during this special session. Thank you very much for your time, and we can open it up to questions. Sure.
Yeah, just a brief closing. So I think Nico has wrapped up, has really summarized the very huge dangers here. And that's these synthetic drugs, that's the fact that they're selling it to minors with impunity. And so we absolutely need to do something here. And this might sound strange from the guy that always wanted to legalize marijuana. But we do have to do things appropriately and responsibly. And what we've done simply is an irresponsible measure. I started along this path a long time ago talking to veterans in this state. I created a documentary called legalize-texas.com. And there you'll see the story of Michelle Walker and her son, who had 3,000 seizures a month. And that little boy, and those two veterans, they had to leave, retire from the Army, go to Colorado where he could be on cannabis oil. And that little boy now has a normal life. I started with the story of David Bass, our veteran out of Coryell County, a retired Air Force captain who was strung out on opioids given to him by the VA. Like so many of our veterans, opioids just were the only answer that they had from the Veterans Administration. And In that time, you saw the suicide rate climb and climb and climb. Cannabis is what has saved the lives of so many veterans in this country. But this unregulated version of cannabis is dangerous for kids. It's dangerous for those same veterans because they're putting products into their bodies that have no regulation, no authority whatsoever. And Nico said from other states, guess what? Sometimes from other countries. And so we've got to do something. We'll open up for any questions for any one of us. Thank you.
Just a quick question to be open up for both of you guys, but I think I've asked you this before. There's obviously some tensions between the medical community and the hemp industry there. Mm-hmm. Is there any world where you see that these two industries can coexist, or does it have to be one or the other?
I don't think this is a one or the other question. It's when you set up a medical program or a recreational marijuana program, and make no mistake, what we have in Texas right now is a recreational marijuana program. It's just unregulated. When you set up those programs, you set up the regulations in advance of giving out the licenses, like they did in TCUP, because you create the appropriate regulatory structure for a consumable industry. That was not created in the hemp industry. And the way I like to think about it is basically that is an industry where drug policy is dictated by operators in the industry and lawyers in the industry now. Whereas with TCUP and with your traditional medical marijuana or recreational marijuana program, the drug policy is dictated by lawmakers and regulators. So that needs to be completely reversed.
Yeah, let me just also explain. On this side of the column here, it's a completely, wholly unregulated system over here. No taxation of any kind. You've got the state of Colorado charging a 15% tax on recreational cannabis. Local communities get to charge another 3% tax. No real taxation over here coming from these people other than the $150 that they spend every year. No way that this legislature ever agreed to let people on this side of this column over here ever thought that we were going to put cannabis in the hands of 14-year-olds. And so can there ever be a space for some of those stores and some of those ranchers? Sure. There could be a space down the road, whether they're going to be providers into the medical program, whether they're going to be approved retailers if they pay real taxes and real licensing fees. But to allow thousands of people to go unchecked and under the radar, just in the name of business, while we poison the minds of little kids, because this can only be done right now in Texas in a medical level. And to allow this Wild West deal simply doesn't work, and it's why we have to do something now. And whether that's a total ban or some form of real regulation, age limits, get rid of the synthetic products, provide hours of when we do this, and limit the number of all of those retailers, because we must. Where we are at right now is simply an untenable situation. And you have a lot of teenage kids accessing a product that heretofore they could never access before.
State Affairs, it's coming to the floor soon. The governor also yesterday outlined some of what he'd like to see. It's not quite the total ban that the Senate bill is, but it has some things like a ban on synthetics. Are you comfortable with something more like what Abbott is describing in terms of restrictions, or is a total ban needed in order to give TCUP a chance?
Well, listen, I can't speak for Nico, but as a member of the state Senate, and I voted for the ban the first time. Right now, I want to see what comes out. And the reason I voted for the ban is because I was promised that we were going to get expansion of TCUP. And we did. And we did. I urge you, by the way, to watch that documentary, because you'll see veteran after veteran after veteran weaning themselves off of opioids on medical cannabis across this nation. We went all over the place. And so to answer your question very clearly, we have to be put in a situation where we get both of these bills presented to us. And I think that that's going to be the process of the next 28 days or so. And we'll figure it out. We'll figure it out, whether that's an outright ban or whether that's age limits, limitations, how they pay into this program. I mean, come on. You cannot allow what they're selling to go unchecked and unpaid for and untaxed on so many levels. So I would like to see a significant restriction of where we're at. And yeah, that's going to hurt some business people. It's going to hurt some of those C stores. But guess what? All those C stores across the state, they were surviving just fine prior to them being able to sell this cannabis. This is just some extra that they get to put on their coffers. And we're doing it at the hands of these young children that are taking in this product. And for that, we cannot have that. We just simply cannot have that.
Another question I have, has there been any discussion in terms of, I think this was especially true when we were talking about during the regular session, but some people, especially kind of veterans who are maybe currently using a hemp product from the market, at some point losing access to that particular product, but the TCUP not being set up in time for that particular person, kind of falling through the gaps. Is there any, I guess my question is TCUP going to expand fast enough? Because rulemaking takes some time.
Yeah, that's absolutely right. And that's something that we do need to work on, which is speeding up the rulemaking and the regulatory side of it to make sure that we're ready for September 1. But we do have the capacity for the next at least 2 years of growth right now, and we're ready to move on that. But really, it's a regulatory issue at this point. Yeah, so we have another facility being built out in Bastrop that will be commissioned later this month at this point. That'll 10x the capacity of basically where the TCUP currently is today, which we view will get us through pretty quickly, at least the next year to 2 years as new licensees come on.
Can you speak to the new deliverables under the expansion?
Yeah.
Delivery methods.
That, again, a really important part of HB 46 was it was going to allow for, and did allow for, vaporization and pulmonary inhalation. We do find that a lot of the veteran base that you're talking about now had either left the program because they had wide access to things like Delta 8 vape pens. At this point, we will now have a medical option for them with actual plant-derived Delta 9 proper medical marijuana vaporization. So we do expect to be able to serve their needs going forward.
And do you view the deliverables as the answer to a lot of the real questions that people have been fielding up, saying that the program is just not accessible to them?
The accessibility of the program today, there's two main arguments that we hear. The first one, there's two main things that we hear, especially when we're listening to the hearings most recently. First is geographic accessibility. So we have pickup locations now that are already spread out across the state. Our only problem is we couldn't keep inventory there, which means that we had to drive back and forth every single day, which created a timeline issue for a lot of patients. That's an immediate fix. So come September 1, most of those locations should now be approved satellite locations that will allow us to keep inventory there, which basically creates a very easy way for us to distribute across the rest of the state. And we'll continue to build those out over the course of the next 2 years. The second one that we hear a lot about is price. And we actually went back and looked at our own pricing to make sure that we were within line. And it turns out that when we're talking about Delta 9, plant-derived Delta 9 in the hemp industry, it's roughly about 20 cents per milligram. That's where we are, is 20 cents per milligram in our industry here on the medical side. So our prices are very close in that regard. Where, excuse me, where we can't compete is the price of things like Delta 8 and Delta 10 and synthetically derived cannabinoids, because it is incredibly cheap to manufacture these at scale by essentially, it's a process called isomerization, but you cook CBD with an acid and it knocks off a molecule that looks very similar to Delta 9, which is Delta 8 or Delta 10. There is no regulated industry that's going to be able to compete on that pricing at 5 cents a milligram or wherever they are. And so that is something that we will have to work with over time. The important thing to know is with scalability in the TCUP, prices come down. And since we started our business back in 2015 through 2018 when we sold to our first patient, the pricing of our products has only gone in one direction, and that's down. And so as the program scales, pricing will come down even further than where it is today.
I got one last question, but this is for you guys. Sort of A lot of things I've heard when it comes to sort of the medical program is sort of the lack of medical professionals participating in the program, talking to the patients about it. Sort of, how do you go about talking to people about this program?
Yeah, that's a great question. And actually, it took a lot of self-education just because, you know, probably the other doctor can attest to this too. We weren't taught about the endocannabinoid system and how cannabinoids can really benefit what's going on in our bodies. We were taught drugs are bad, and you know, here are the toxicity symptoms, and here are the withdrawal symptoms. And so, it took a lot of self-education. But I think it's growing, especially with more and more physicians learning about TCUP, and more patients coming and talking to me like, "Hey, my neighbor told me about medicinal cannabis and they had cancer too. Could I get it for me?" You know, and now with the expansion of the diagnoses, I think that's just going to grow even more. So, you know, I'm reading, you know, webinars. I even went to CanMed, which is a large conference for medicinal cannabis this summer. You know, so it's just a lot of self-education and just making sure that you're finding, you know, those good resources and experts. So. And then passing that on to the patients and making sure that they know that, hey, you know, I've taken time to read about this. You know, and when you come ask me about what about this hemp product that I just got from, you know, this mom and pop shop, I tell them like, look, this is unregulated. You know, you may be getting stoned off of this because there is so much in here that's intoxicating you. So let me help you get something legal and regulated, and you know exactly what you're getting.
Also, a question for doctors: do you generally see these patients? They're just coming into your practice, or are they over the internet, or are they in other regions outside of like where you're physically located?
For me, I see only the patients who are tied to an oncologist in our practice. So I know there are access points for patients who aren't, you know, they don't have cancer. Maybe you could speak more to, you know, how you see your patients. But yeah, for me, it's just in my practice that I supply for.
Mine are also currently just within my hospice organization. I'm starting to get some interest from others, but I am trying to work through how to roll that out as I'm one human, to make it something that I can assist patients and their families managing the symptoms and determining. I do a lot of tweaking. I look at the ratio, I look at the dosing time, the dosing frequency. There's a lot behind. It's not just popping a gummy. I mean, if you can pop a gummy and get what you need, that's great. But that's not what most of my practice within the medical cannabis consists of. So, you know, I think that it's growing, and I work in this area. More and more hospice organizations have been reaching out to me. You know, I think that this is something that can only do good as long as it's done the right way and we limit the risks. You know, I hear a lot about you all so eloquently explain the economics of it. There's also a real safety problem here because unregulated means it could have anything in it. It's not, sorry. No.
Thank you.
You get away with it. Sorry. So what I was also saying is that from my perspective in terms of caring for people, we need to think about the safety of the synthetics and the non-regulated products, because even pill to pill or, you know, vape to vape, they're different. They may be different, and we don't know. And so that's exposing our constituents to a lot of risk that's unnecessary.
I know this is up to kind of the regular, this is for you, Nico. This is a little bit up to DPS, but for someone who's, you know, kind of wanting to get in on this program, but is currently, let's say, in Lubbock or El Paso or somewhere that doesn't have physical location and feels like it's not accessible, when can that person kind of expect to see something open in here? Like, just rough timeline. Are we saying months, years?
In terms of actual pickup locations, it'll be this year, because one of the pieces of HB 46 is that each of the licensees has to have a satellite location in each region before they double up in other regions, which again is a great thing for accessibility. It becomes a really difficult thing if you do not dramatically restrict the 8,000 hemp licenses out there, because you can imagine putting licenses in rural areas where there's 5 hemp stores. We're now mandated to do that. It doesn't make any sense because people likely won't come in there if they think they can get, you know, a cheap Delta 8 product. So by the end of this year, we will have satellite locations up and running, but the reality is if you're a patient in Lubbock or El Paso, we already serve you. It's just we're delivering medicine out there on our trucks at this point. Great. Thank you all. Appreciate it.